Let's try to keep. Oh, yes. Good job. We always forget to start that. So thank you so much for joining us. And these are just some of our housekeeping items to keep in mind. We're going to have a presentation at the beginning. And so keep yourself muted if you have running children around you like me. And make sure that if you want to participate, you raise your hand. You can use our chat as well for some of the activities that we have and for the updates later on. And I will pass it on to Yao to continue. So Yao is here from Siwa, and she'll give you an overview of our core group.
Okay, thank you. Thank you, Rebecca. Good afternoon, everyone. I'm pleased to welcome all of you today to today's interagency meeting. It's so wonderful to see all of you from various agencies across the province to gather here to continue our collaboration to support the immigrant senior community. Excuse me. So for some of you who are new to this group aims to increase collaboration and connection among service providers who work with immigrant and refugee seniors in Alberta. It is a space to share some of our experience, emergent practices, highlight existing gaps, and address challenges that we're all facing. Through this platform, so we can share resources, share knowledge, and together we can achieve something really great. That's my little introduction of our group. So for now, we're going to ask you to do a warm-up activity in the chat box. Like, we don't have the time, like Rebecca just mentioned, we don't have time to go around everybody. So we would like you to put in a chat box your name, your agency and job title, and probably maybe one fun thing that you've done in summer. I know this is the end of the summer and we really don't want it to go. So feel free to share one thing that you look forward to in fall as well. Okay, we can do that quick warm-up activity. So I will just put mine in the chat box so you know what to do. Your name, the agency that you work with, your job title, one thing that you've done that's very fun, one fun thing that you've done during the summer, and one thing that you look forward to in fall. Okay, everybody, please feel free to type this in the chat box. So we still have that. Okay, see here, I will put mine. Okay.
There's some exciting things that have happened here.
Yeah.
Yes. Tatiana is looking forward to Halloween. Oh my goodness. Halloween
Me too.
Everything's out of the stores already.
Yeah, me too. That's the only one thing, the one fun thing that I think that's pretty like we can look forward to. Otherwise, the winter depression is gonna hit us hard. Okay, thank you everybody for sharing, and we're gonna go around the room after the presentation. So we still have chance to talk, to catch up with each other. But we for some of you may know, I've already know that for the past few meetings, we've talked about a lot of challenges that the immigrant seniors are facing. And we have built up some awareness of elder abuse thanks to Dr. Judy. So today we are very honored to have two guest speakers from the Primary Care Networks joining us. Welcome Heather and Lisa. So they are going to give us a presentation, and I believe their work is crucial to ensuring that that we provide comprehensive support to our clients, especially their seniors, vulnerable population, right? So I think they are doing a very meaningful job, and thank you so much for coming to join us today and share your insight. And I believe by collaboration, that's or like the sharing knowledge, and we can help more people that we're serving. Thank you so much, Heather and Lisa. I'm just gonna pass it on to you, and you can have this presentation. Thank you.
Thank you very much, Yao. And I'll say it's just me today, unfortunately. Lisa has a community event that she's setting up for us, so we're tag teaming today. I'll just get ready to share my screen here, but I'm really excited to be here with everyone. And I'm hoping that our session today can be really interactive. Feel free to put questions in the chat that you might have. I certainly do not know everything about seniors health or refugee health, but if I don't have the answers, I can go to my colleagues for those and bring them back, share them back with the group. So that's not a problem at all. Can everyone see my screen now? Yeah? Okay,
Yes.
great. Let me just get this going. Okay, now you can see the full slide. Okay, great. So again, my name's Heather. I'm with Mosaic Primary Care Network. I'm not sure how familiar everyone is with the primary care networks. So I'll go through a little bit of that at one point in the presentation. My department of community partnerships and engagement is a new department here at Mosaic, and it really reflects the desire to be more patient focused, to work more closely in collaboration with partners so that we're not duplicating the services that exist. And so it's great to be interacting with a group like this where you're looking to collaborate specifically. So this is a new department, but when I first joined Mosaic, I was overseeing communications as well as community engagement and engagement with our member physicians. And we're just growing and expanding and giving everyone a little bit more capacity. So the things that really excite me is being able to connect with community members and listen to what community groups and what the public are saying are some of their barriers. What we're really trying to uncover is what are the barriers to receiving the healthcare that people need, specifically when it comes to primary care. And then what can we do with some of our community partners out there in terms of new initiatives to reduce those barriers, remove them, and just increase the access to primary care, to wraparound services, and also to anything else that they might need out in the community that we could potentially refer them back to. So,
Heather, just so you know, you're not on presentation mode, but
oh,
I don't know if you want to
it's
be.
not. Oh, it's not showing my other screen. Let me just switch. Stop and be sure.
There
How's
you go.
that? Is that better?
Perfect. Yep.
Good. Thank you for letting me know. And now I'm going to try to make sure that my video will work. Optimize. Bear with me. There we go. We should be good. So, oh, and I've lost all my view of you guys now. Can you still hear me?
Yep.
Okay. I've lost all my screen of you guys, so hopefully someone can shout out if there's questions coming in.
really what the primary care networks look to do is help to give people a patient's medical home, that spot that they can go to. They have their family physician within that patient medical home, but then they also have ability to access all of the other wraparound services that they might need through that provider, and make it as seamless as possible to connect with anything that they might need. So we have a video that explains a little bit about a patient medical home. And this is actually available in 10 languages right now on Mosaic's YouTube page. So if it's something that you watch and you think might be of value for clients, definitely feel free to share that with them. So we'll give this a go. Cross your fingers.
We are Solventum, newly independent and more focused on solving your toughest healthcare challenges by pushing the boundaries of health, material, and data science even further. We never stop solving for you.
It's a tasty treat of ooey gooey fun. Rice Krispies Squares bars.
Meet Priya, a 37-year-old working mom in Northeast Calgary. Priya knows that building trusting relationships and establishing a network of support is important for her family and her personal health. That's why Priya and her family are part of a patient medical home. This means they always visit Dr. Sharma, their family doctor, whenever they need healthcare services. Dr. Sharma's clinic is a friendly, welcoming place, exactly what you would expect from a place called home. Seeing Dr. Sharma for regular wellness care often prevents Priya and her family from getting sick. Priya also has support within the medical home by a whole team of experts who can help her with things like healthy eating, quitting smoking, managing diabetes, coping with depression, chronic pain, and many more healthcare opportunities. For example, Priya was experiencing pain from hip bursitis. She visited Dr. Sharma, who referred Priya to see a kinesiologist to learn some exercises. At first, Priya thought, there's no way exercise will help ease this pain. But it didn't take long for Priya to see how the exercises made her hips, low back, and neck feel much better. And the kinesiologist kept track of Priya's progress to make sure she did the exercises properly and that her condition was improving as expected. Dr. Sharma's office even called Priya to book a follow-up appointment at their clinic. After getting a consult note from the kinesiologist, Priya was amazed by how much every team member in her medical home was looking out for her health, and she learned how the team ensures nobody gets forgotten in a complicated healthcare system. Another Calgarian happy with his medical home is Naveen, a teacher new to Calgary who was diagnosed with type 2 diabetes. He also had high cholesterol levels and was finding it hard to lose weight. Naveen was struggling to manage all of these issues on his own until he became a part of a medical home. Naveen now had a doctor, a diabetes nurse, a dietitian to help him with healthy eating, and a pharmacist to help him with his medicine. This is a whole team working with him to achieve his health goals. Together, they were able to reduce Naveen's blood sugar to normal levels within 4 months. He was also able to eventually reduce his cholesterol, blood pressure, and his weight. Based on his previous experiences, Naveen thought he would be struggling with diabetes for the rest of his life. So he was very pleasantly surprised by how quickly his medical home was able to help, and by how easy it was for him to have control over his own health. Being part of a medical home will make medical care quick and easy for you too. It is the starting place for all your medical needs, where you can discuss all your concerns with someone you trust will take good care of you. Everything is private and confidential. Your medical records are not shared with anyone outside your medical home. And research shows that people who have a continuous relationship with a family doctor and healthcare team live longer and they visit the hospital less. Being part of a medical home will help you feel more in control of your healthcare and will empower you to make well-informed health choices for you and your family. To get set up with your own medical home, visit mosaicpcn.ca or call the number on the screen.
All right. Are you guys back to seeing my PowerPoint slide again?
Yes.
Okay,
Yes.
perfect. Thank you. So that gives you a little bit of an idea of what really the PCNs are trying to establish in terms of this patient medical home. And I'll go into a little bit more detail later on in the slides around the PCNs and Mosaic in general, but I thought it might be nice to just talk about a few things for immigrants and immigrant seniors specifically, and refugees as well, that when they come to Canada might be different about our healthcare system. And there are things to keep in mind that we see as common sort of misunderstandings. So our system in Canada is very appointment-based, and it's based on timeliness as well. And that may not be the case in every other country that people are coming from. So they may be surprised to find out that they're not going to be seen for an appointment if they're late for it. We also have a preventative care focus, which is not the case in every country around the world. So patients are encouraged to see a family doctor or a nurse practitioner for that annual checkup, and then appointments with specialists happen through referral. So those might be things to speak with people about as they're encountering the system here. Also, in general, we don't pay for these services. So this is as long as someone has provincial coverage set up. And I was asked to speak about the interim federal health program, which I'll give a few more details about as well. So as long as these things, one of these things is set up, we don't pay for these services. Also, our medications here must be prescribed, so they can't be bought or renewed without that prescription, which is different than some places. And there have been some advancements. You know, the contraceptive piece is not applicable to many of our seniors, obviously, but in 2024, the government has made diabetes medications free for all Canadians, which is a really great step forward for people managing that disease. So a little bit more about the PCNs. Again, some of you may be familiar with them, some of you not at all. PCNs were established by the provincial government in Alberta just over 10 years ago, and they really span across the province and each have a specific geographic area that they're responsible for providing services within. We are an organization that is based on membership by family physicians, and now with some of the changes, nurse practitioners who become members of our network. And as members, they receive a lot of different support services that help improve their practice, help them have a better patient medical home, and be able to refer their patients into our services and programs. So Mosaic is based within Northeast and Southeast Calgary. And you can see the outline of our catchment area there. We currently operate, or we were operating 5 clinics within this area, and that was for those other wraparound services like mental health, dietitians, kinesiologists to have appointments at and operate within. We are currently in the process of consolidating those clinics actually down to 1 space only within Sunridge Mall. And that's going to happen in 2025, hopefully very early in 2025. We've closed a couple of our spaces already and are just transitioning folks for appointments to the other spaces that we have for now. But the impetus for that was really having a space where all of our providers could collaborate together. Patients would have an easier time, say, seeing a practitioner for one thing. Maybe they're managing diabetes and they have an appointment with a dietitian, and then they have another appointment with a kinesiologist to talk about different ways they can manage that chronic disease. They'd be able to do that all within 1 space. And the new space is also close to the C train line, which we hope helps with some of the transportation challenges that folks may have, as well as a secure site for both our staff and our patients, having them all security, and then our own security just offers a little bit more than a standalone clinic, which we think will be helpful. That being said, I know in some of my community conversations that some of the challenges that have come up is the time it takes to get to appointments, or not having services right within their community. So I think as we go forward, that will be an important consideration, is how do we work with some community partners and perhaps offer services in a bit more of a remote fashion in some way where we know there's a need for people who maybe can't access this clinic site. And we do operate virtual appointments as well, so that helps. So one of our services here at Mosaic is a refugee health clinic. We are in the process of transitioning that clinic from being just a Mosaic clinic to hopefully more of a Calgary-based clinic, or even a provincial clinic, given that we do see anyone coming into Calgary, settling in Calgary at that clinic. They might not be living within the Northeast, which is really our designated area to provide care. But this clinic receives referrals of folks coming basically through CCIS as they come into Calgary. And it's meant to serve those patients who have really complex health needs and have things like acute illnesses or chronic diseases that they need to work on stabilizing. And the team there works with them to provide some education that helps them to better navigate the healthcare system, with the goal being to transition them out to a general family care practitioner within their community once everything is settled. And so again, just to touch on some of the coverage for folks who might be coming in from out of the country, there is a program called the Interim Federal Health Program. And this is for any refugees coming to the country who qualify. They will be covered for up to a year until they can receive their provincial health care. So just like anyone moving to Alberta, they do have to apply for coverage under that Alberta healthcare insurance plan. But in most cases, newcomers will not need to apply for the interim federal health program coverage. Their immigration status will determine their eligibility, and that coverage is activated automatically. There's a couple of good sites that give some information for people who are looking to find out a little bit more. And I've mostly referenced this refugee care site. It's a great resource, I find, with lots of good information. So definitely something to check out. But basically, this is temporary coverage to protected people within Canada. The plan is administered by Medavie Blue Cross. And so physicians who are providing care to patients with this coverage must first register with Medavie Blue Cross in order to be able to bill them. So that is one thing that some patients may run across, is a physician who maybe hasn't gone through that process of applying before. We try to provide some good education through our refugee clinic as well to the primary care providers in our community about how to do that, what the process is, make it a little bit easier for them. So there is some different levels of coverage under that program. And here's just a basic outline of them, but it really depends on your status, and that determines what you would be eligible for. So the basic coverage is similar to our provincial plans. It covers those outpatient services as well as inpatient services. laboratory and diagnostic tests, ambulatory services. And then there's supplemental coverage, which would cover you for things like dental and vision care, physiotherapy, other types of medical equipment, and prescription drug coverage. And those are for medications that are listed on the provincial lists, as well as some special medications that may be specific to refugees as a need. So again, I'm certainly not an expert on these insurance plans and what the process is, but the refugee care website is a great resource. And I know our refugee clinic staff are always happy to help different groups with some education sessions as well, if people are wanting to go into more detail. So another bit of information that I thought would be nice to share, and this comes from our refugee clinic team, just a couple of tips for people who might be going to a general physician or a nurse practitioner for the first time. Highly suggest, if they can, having a support person join them. And also trying to confirm in advance that that physician will see patients with the interim federal health program coverage, if that's what they're using, just to avoid any challenges or issues once you arrive there. There's also a list of refugee-specific screening tests on refugeecare.ca that are recommended for people coming from outside of the country. Again, it may be more specific to certain regions that they're coming from, not something that every immigrant would need to have necessarily, but highly recommend asking the physician to do some of those screening tests, as well as anything else that's appropriate to their age. And another note that I know through most of the PCNs, the member physicians have access to a service called Language Line that they can phone if there is a need for translation. So they use that right in the consult room with the patient, and it allows for that translation to happen right on site during the appointment. The other thing that's challenging, not gonna pretend it's easy, is finding a family doctor within Alberta. It's been a real challenge, and I think the last couple of years has only gotten more challenging. There is a provincial site called Alberta Find a Doctor. This was started by the primary care networks, but has since been scooped up by the province. So there's a lot of investment going into it right now to make sure that it's operating as strongly as it can, that we have good information flow there. And the idea is that people could go in and search for a family doctor by visiting this website, so they can enter their location, any preferences they have in terms of gender and language, and it'll pull up a list of physicians in that area who are currently accepting patients. Now, of course, it's up to physicians to keep this information up to date. So there are times where they are accepting for a period of time and then it doesn't get changed, and patients contact them and end up finding out that they're not actually accepting patients. So this can be quite a challenge for people to navigate. There is also a function to be able to register yourself. And what happens with that is that a message goes directly to the appropriate primary care network within that area. And I know here in Calgary, all of our PCNs have been working really hard to address those lists of people that might be having a hard time finding a doctor. We're really working at Mosaic on increasing the ease of finding a doctor and getting connected to one. So we have some attachment nurses that are working specifically on calling people back individually from that list and seeing what we can do to help them out. But it is a great resource. Besides just the family doctor information. There is also some free workshops and programs that anyone can register for. So that's another nice use of that site. So a little bit more about Mosaic specifically. Here at Mosaic, we have over 400 primary care providers that are members of our network. And so they are referring all of their patients into our services. So this really helps you to understand the concept of the PCNs. You have your primary care provider, and they're able to refer out to all of the PCN services. So these are all the services that a PCN provides, and they're a little bit different between the PCNs depending on their catchment, their geographic area, and what the needs are of the population there. But you can see here at Mosaic, this is a list of some of our programs and services. And then a little bit more detail around what those are. So our primary healthcare team is really trying to assist with some of that preventative care, giving people support, education, guidance when it comes to managing different chronic conditions, things like diabetes, managing high blood pressure. We know that increasing physical activity obviously has a great impact on a lot of different chronic diseases. So helping them figure out how to do that. We have several tobacco cessation programs that are linked with the AHS programs that we put people through, help with nutrition, diets, and like I said, managing those medications that can be a little bit tricky. We also have social work and mental health teams. And one of the great things about these teams is they can take a group such as seniors and really help them access all of the benefits that are available to them within Alberta. So if they're really struggling with financial pressures, if they need some support in accessing all the benefits available to them, they can help walk them through that. They can suggest some resources out in the community for aging in place, and then obviously address some of the other mental health challenges that someone might be facing after coming to Canada from another spot. The other program that we have, which is a great program, and it's currently referral based from within our multidisciplinary team members, but it's the Community Health Navigation Service. And this was a research program or project through the University of Calgary that has now been expanded into a permanent program here at Mosaic. And I think we'll find that that expands as time goes on. But the idea with this is to help patients with those long-term conditions navigate their care and find the available services within the community. And the ultimate goal is to help empower them to manage their health on their own, to think about what their goals are, and set some ways that they can reach those. So these really are not health professionals, but they know the community area, and they're trying to teach those patients how to navigate those resources. So you can see some of the things that they work through with them around system navigation, self-management, and social connections. This is a program that I could see being really valuable for immigrant seniors. And I think something that could be a potential longer term opportunity if we can have the ability to work with some of our partners and refer people specifically into the Community Health Navigator program. Versus them just being identified through our own team members. And then a little bit more around that health prevention. So classes and workshops that we may offer virtually or in person. We have a pain management program that helps people. I think it's a 6-week program, and then they have additional supports after that, but really if they're dealing with chronic pain from a certain condition, how can we help improve their quality of life going forward? And even things like our dietitians giving really culturally appropriate dietary recommendations, nutrition recommendations that will work for each person depending on their background and their situation. So that's the mosaic portion. I have a couple of other slides that I'm hoping we can have some discussion about, but is there any questions specific about mosaic or the PCNs that I can offer in the meantime?
Heather, I have a question. Tatiana is here. Could you clarify, is that every physician has a membership with one of the PCNs, or it's purely voluntarily membership? And if there is, what may be a reason for them not joining a PCN? I'm just curious. Yeah.
It is purely voluntary. I think we find within our catchment area, I think about 95% of the physicians are members. So it's not something that we have to work overly hard to like let people know about, but perhaps they might not be joining because they just don't know about the programs and services. We have a couple of different levels of membership, and one is a general member, but the other is someone that has a little bit more support for that medical home. So they have one of our staff people that help with some of their records management, and they have, for example, support from us to do some quality improvement programs. And they receive some reimbursement to have those services as well. So there's not a lot of drawbacks to being a member. There are some expectations in terms of doing that quality improvement work. But yeah.
That's helpful. Thank you. I see Min has her hand up.
Yeah. Thank you, Tatiana, and thank you, Heather, for introducing Mosaic. And I feel like it provides many innovative services. Yeah, you may already mentioned, but I just want to check with you. Could Mosaic provide in-home Medicare for the seniors also who has mobility issues? Yeah.
Yeah, it's not something that we have currently, but I think it is an area that is worth exploring. Like I said, we're really doing that deep dive right now into what are some of the barriers to people getting care. And if that does come up as one of the top ones, which I wouldn't be surprised if it did, what can we do that would be offered either, you know, within home or close to home? So it's something to keep in mind.
Yeah, thank you. And I do find for our senior clients, they have that concerns, you know, when they get really old. Yeah, how would they best support themselves? Yeah, the second question is about the language barrier. Many of our clients can't speak good English. So do you have physicians who can speak a diverse language, or you have some solution for the language barriers?
We do. We really pride ourselves as well on all of our staff really speaking different languages. We have a very diverse staff population. And hire a lot of them based on having the languages that are commonly spoken within our neighborhood and our community area. But we do also provide a service called Language Line. And so it's a phone translation service that's available to any of our providers to use when they're seeing their patients that can kind of bridge that gap to translate for them.
Okay, so is it free? It's free, right?
Yeah,
Oh,
there's no,
okay.
we pay a fee for it, but offer
Okay.
it to all of our members and all of our staff providers as well.
Okay, it's like a AHS interpretation line like that, right?
Yeah,
Okay. Okay. Sounds good. Thank you, Heather.
you're welcome.
Okay.
So I did try to add a few other provincial resources in here. Obviously, a lot of these are focused more on Calgary and our specific area here. Probably the group might have some other great suggestions in terms of resources. I'm happy to share this afterwards, but these are some resources specific to immigrant health that would be useful for people. I don't know if we probably have some other folks. It sounds like we might even have someone from one of the other PCNs, but certainly happy to put together an additional list if people have recommendations.
We have another question for you as well, Heather. Jordana has a question, has their hand up.
Thank you.
Jordana, you are muted.
Sorry. Hi, Heather. Thank you for the presentation. I know about Mosaic, but this was a detailed overview of the services. I'm really interested in the community health navigation services. Has that been trialed specifically kind of tracking how immigrants in general maybe, but then also immigrant older adults are using this at all?
You know what? I'm not sure about that. Like I said, the program did transition from a U of C program to just a Mosaic program. So I know it's expanding, and I have a meeting actually set up with them next week to just explore a little bit more about where they're at. But I would be interested to see some of that data around who have been the most common users and how we could expand it to specific groups like the immigrant seniors. So
yeah, because certainly
stay tuned for that.
Yeah, big gap there. I think there's a big need, that and the health prevention and promotion program. So thank you for that.
So that leads really to some more of those conversations I was hoping to have, because I think you guys have already had some of them. Like, what are some of these barriers for immigrant seniors? And I know among our team, some of the things that have been identified are listed here. Obviously, the navigation piece of environments of communities, and then these office buildings specifically, is challenging, and needing those longer appointments, needing that culturally appropriate treatment for people to really think about how do they eat within their culture day to day. And so what might be the right kind of recommendation for healthy eating for them. Some folks may come to Canada with incomplete medical records, or records that are in other languages, or they don't even have medical records. So those are some of the barriers that we see for this group, but I may just stop sharing, and I would love to hear from everyone else about what you've seen as some of the barriers.
And while Heather's just wrapping up there as well before she starts on the next bit, I just want to also point to Carolyn's comment in the chat. Carolyn said earlier about 95% of physicians in Alberta are family doctors, are part of the PCN, a part of a PCN. Each PCN is a bit differently designed to meet the needs of its patients.
Thank you. And Carolyn, are you from one of the PCNs?
Yes, hi there. Nice to see you, Heather. I'm with Edmonton Southside PCN.
Oh, great. Thank
Yes.
you.
So great to hear about your program, and I'm going to reach out to you afterwards.
Awesome. So does anyone else have some feedback, some additional barriers that they see for their clients, or even from the ones that I had listed? Are there some that stand out for you as bigger than others?
Hi, my name's Amanda. I'm a community link worker at a Vulcan, Alberta, just south of Calgary. I work with a social prescribing program with older adults. And yeah, I was just working with clients. We have a doctor taking new patients in. And so I've been able to help. We have a lot of, I guess, low German Mennonites who have come from Mexico who don't have any doctor records, kind of like you mentioned, like the birth has, like, if they have children, it was usually like midwives. And so yeah, that was just a little eye-opening for me, is that part of the new patient package is to put any of that medical history, and I usually just put like NA. So yeah, that's definitely a barrier. And then also trying to explain to them when they're looking for medical family history, you know, that terminology there. I'm not a language specialist or anything like that, so it's hard to, they understand some words, of course, like cancer and heart, but yeah, it's definitely a challenge for them.
Yeah. I think that's why too, some of that additional screening at the outset is so important, because we may be starting from, you know, you're trying to almost start from scratch with knowing where they're at without having that medical history, and sometimes can identify things that maybe they're not able to communicate, but knew were an issue or had as an issue previously. Thank you.
I've noticed that in the list of the barriers, I haven't seen financial barrier, in a sense that, and it's not necessarily related to the PCN only, but to any physician. While the access to medical services are free, but most of the medical forms that the doctors complete, the doctors charge for those medical forms. And I've noticed that many seniors who are not Canadian born, that like for them it's a surprise to pay for a medical form, either to apply for benefits or for the that handicap sign for their car, you know. So that we have to explain that this is kind of sort of outside of the worker of the doctor's role, and they kind of get also sometimes upset that the price is not set. It sort of varies from doctor to doctor. We see from $20 to $100. And for some seniors, they just don't do it because they don't have financial means to pay $100 for a medical form. So that's kind of one of the barriers that I've seen as well.
That's great. I never would have thought of that, but you're right. That would be absolutely a challenge and a barrier. So that's a good flag. I'm curious to see if any one of my colleagues knows how we've helped with that, or if we've been able to help with that in the past. So, thank you. And we had one in the chat too from Caroline: isolation, elder abuse, and that fear to share when things are not going well. I think that's a big thing. I was talking with some folks previously, and they were saying, you know, a lot of these people they've come to help their family and their children, and others, grandchildren, and they'll do anything to help them, take care of them, before they would do anything to help themselves. They kind of would first leave themselves off the list. So. Stephanie, you mentioned that you've been using the Google Translate app. Do you want to mention that?
Sure, that was in response to, was that Amanda? Amanda, you talked about Vulcan?
Yeah,
Sure.
you betcha.
Yeah, that was you. Yeah, I've been using it a lot I don't know if folks have played around with the updates to the Google Translate app, but there's a conversation function that you can just activate it and put the two languages and set it on the table and then have the conversation back and forth with each other, and it verbally translates live, which is really nice when you're just trying to get those extra little pieces that you might not have a translated resource for, if you just want to have a live conversation with somebody with low English. I've been using it a lot. And then the other one I've been using a lot is also an app. You can switch it to a camera scan view. So then you can just hold up your phone to whichever document and then it live translates that into the other language. Or you could even put detect which language and it'll detect which language is in the document and translate it. Which is really nice too if you didn't have a translated document and you just needed to try and figure out a few things to sort out with them. Yeah.
Awesome.
Stephanie, what's the name of the app?
It's just Google.
It's
Google
all
Translate.
it's all through Google. Okay, awesome.
Let
Good to
me-
know.
let
Thank
me-
you.
Google Translate.
So even the documents that
Yeah.
you just okay.
Yeah, if you open the
Awesome.
camera and then scan it at whatever language, either you know the language or you don't, you can put detect language and then translate that into whatever other language. It's like it's not perfect, but it does a pretty good job nowadays, I've found.
Awesome.
Yeah.
Thank you.
The only ones I've noticed that it hasn't been really great at recognizing are the Alberta Indigenous languages. It doesn't really have Blackfoot or Cree or Dene or in the database, or even like Ojibwe, or like it doesn't have any of the Indigenous languages here of Alberta.
Anyone have, besides the barriers, just, as a starting point, things that they would really love to see change within, obviously I can't change the whole healthcare system. I'm not sure I'd want to be the person to do that anyway, but are there things that pop to mind for you that you think, if we could just change these couple of things, it would make life so much easier for these seniors specifically?
I'll just make a comment. Sorry. I do work in the area of elder abuse quite a bit with ethnocultural communities, and as you mentioned, I think it was Heather and somebody else I think in the chat was also talking about long-term care and elder abuse. In particular, the conversations that I would have with community members is, in addition to the language barrier, it's also the fact that some of them might be illiterate in their own language. And so translation and interpretation of documents might really not make any sense to them. And there's this ask about having audio files or some form of verbal method of communication with them, or relaying of information that might be really helpful for those who don't really read or write their own language, because there's an assumption that they would, but that's not really the case sometimes. And in addition to that, it's really just generally their lack of awareness of what supports and resources are available to them, just in general, really. It's not that they know they have to go to the doctor if something's wrong, but they really don't know, especially if they're coming from communities, backgrounds, or countries or experiences where having that available access all the time to healthcare is not really a norm. And so I think just really a general awareness of what support is available and what is funded, what is not funded. I think that was with the conversation. Sorry, I'm trying to find out. I know it was someone in here who was mentioning that. I think it was Tatiana. Was it you who was mentioning that component of not knowing what is available and being able to be kind of clear with that too. But I think that is also something, just that general knowledge. And I would also stress that when working with ethnocultural older adults, some of them are sponsored by family members, and the onus on relaying knowledge and information about what their rights are is usually on the adult child or the person who sponsored them, and sometimes that doesn't happen. So you have older adults who don't know that they can have access to old age pension at a particular stage in their life, and that information is kept away from them until somehow they find out that their adult child has actually been taking this pension in their bank account and not giving it to the older person, which is financial abuse. And so I think sometimes it's just really those who are sponsored in particular, who are, there is an assumption that there is a different entity that will give them information about how they can navigate our systems and live healthier, good lives as they grow older. They're the ones who are sometimes falling in those gaps and in cracks, and they're the ones who actually need the information the most, so they are not taken advantage of. And the ones who are skipped sometimes because there's an assumption that there's an organization or a family usually who's going to give that information. And what happens if that family doesn't have that information themselves, right? So I think just that general knowledge and education and information piece about what your rights are and how to protect yourself, I think is important.
That's great.
Yeah, I just wanted to add to Dr. Rosie, what she said, like, as Dr. Rosie mentioned, like, because of the sponsorship, like, especially, like, maybe they are okay to get the, the physical or, the health for their physical things, but not the mental health, because especially it's taboo, and then receiving services for the mental health is taboo, and then the family members, they're just trying to tell them, oh, don't even to talk to anybody because you will be in trouble, and then you're not going to get your citizenship, or we will be in trouble. And this is something that we see that in our immigrant seniors, they are just avoiding to talk to anybody, and they try to not sharing anything about themselves. And in addition, because of the cultural component, they are the one who everybody was coming to them to just ask, to support them in terms of like the elderly in the family. And then I think mental health is a very big component, and sometimes even if they really need that, they wouldn't have capacity to access that because they are sponsored by their children. And then for the counseling, if it's supportive counseling, for sure, like we can support them. But when it comes to the clinical or therapy, they need the psychologist, then they have to pay for it. And then that is something that these immigrant families, they don't have that opportunity to receive those services. I think this is one more challenges for the immigrant families as well, seniors.
Can I also add, Azita, now that you've made me think about it, I've also had discussions with ethnocultural community members about the appropriateness sometimes of particular tests or examinations, and whether or not they feel, for example, physical exams for women in particular, it needs to be matched, a female doctor to a female patient. And vice versa. And some of these things, like those physical checkups, like pap tests, for example, or breast scans, etc., they have to really be approached from a very sensitive cultural component or understanding. And the fact that back home they didn't have access to that, they don't know what these are, and then have that general education and awareness about what they are, why it's important, how it will protect them, the benefits of that, and how often do they need to do it. Just those bits of information that come across in a very sensitive and culturally respectful way, I think is very important. And then just to have that match. And I know sometimes that's not something that's possible, that could happen all the time, but I think it would open the door to more ethnocultural members to go to their appointments, etc., if they felt comfortable and safe, especially if we're talking about people who have experienced traumatic experiences back home, and rape and sexual abuse and traumas and things like that. So those things have to be really kept in mind at the forefront, I would say, at some of those conversations about how we can encourage ethnocultural communities to actually attend their appointments and be, on it and actively attending these things. Thanks.
Absolutely. And that's where I would hope one of the benefits when it comes to not necessarily that side of the women's health services, but the mental health piece too. We've had some conversations with some partners around the anonymity that at least a broader clinic has when, someone can say they're going to a doctor's appointment, but when they're there inside that space, it's hopefully a safe space for them where, if another practitioner identifies that there could be some need for some mental health supports, they could see a counselor while they're there without, seeming like they're going to a counselor and worrying about members of their community judging them or their family judging them for that. So.
We have some great comments in the chat I'd also like to highlight for the discussion. I found family caregivers are having a lot of challenges regarding finding resources and systems navigation, especially for immigrant caregivers due to cultural aspect. And then a second comment, government structures would like to see greater impact on provincial cabinet portfolios, having to work more closely with others like social services, housing, health, etc., to increase the emphasis on the social determinants of health, create wraparound to respond to the needs of seniors and immigrants and everyone. If the government pushes that approach, then the expectation is set to encourage greater collaboration and to support others. They dream. And there's some responses to that around how social prescribing has been creating good collaboration around that for this kind of collaboration. And it'd be really nice to see some of this higher up put in place in policy.
Agree. I hope that some of the change that may come, but that's what I'm seeing too, is really that need for navigation is so high, and how can we we try to be very efficient and effective with technology and pushing people to websites to find things, and that doesn't work for every population. And so I think we need more emphasis on those types of navigation services to help people, at least in the beginning of their journey or their time here, to find those resources and connect to them, and then they can be more independent. But I think that's a high need I'm seeing for sure.
Well, I want to also mention that in many cases with ethnocultural seniors, independency is not achievable. So we have to accept that it's for the social services, it's a long-term ongoing clients, and providing this culturally sensitive system navigation, it's extremely energy, time, and resource consuming, and the community sector does not have this capacity. every, especially if it's a new immigrant or refugee who is older adult, and we try to provide them with a link or support worker or navigator who would speak their language from their cultural community. That requires hours and days of ongoing work, especially when we try to remove the family members from these conversations, either due to suspecting abuse or just because of the family dynamics. Again, like people come to Canada and they don't realize, they don't know the realities, and even if it's a loving family, but things happen. So very often, for the sake of preserving good relationships, we have to remove the children or grandchildren out of the equation, and work just with the client and the link or support worker. And that's hours and days of work, which again, unfortunately, the community sector does not have this capacity. And again, it's very often the independency is not achievable. Stability, yes, but not independency.
Yeah, that's a very good point.
Well, do we have any other questions or final kind of feedback, remarks? Min, you unmuted yourself, maybe. Yeah, I see that you probably have a question.
Yeah, and I heard everyone's brilliant sharing, and I just come up a quick question. And currently, we are doing a federal government project, which is Pursuit Happiness of Immigrant Seniors. We are required to help each client to create a healthy aging at home action plan. It covers 9 sectors, including health, home, transportation, finance, etc. And I do feel I need a booklet which covers resources of each sectors. I feel like the seniors are eager to know their rights and their financial resources, how downsize housing resources. I feel it's quite challenging for me to find the resources efficiently. The quick question is that, does anybody know any, resources which available and I mean efficiently available, like a portfolio? If not, maybe I would like to suggest maybe we can together initiate a project, it's because federal government is promote aging in place. So how could we best support that? Yeah, we need some resources or, collective actions. Yeah, thank you.
Yes, great suggestion, Min. I will put some resources in the chat. We are lacking on these for the province, and there are definitely conversations going on about what can we together as a healthy aging network do to create this comprehensive resource packages. That being said, I would like to point out that if you are in Calgary and Edmonton, Unison Kirby Center has Unison for Generations 50 Plus, formerly known as Kirby Center, has a great one for all of the Calgary or all the Alberta and federal and Calgary resources that affect Calgary older adults. And then Sage Seniors Association has a great one. They're both like huge guidebooks that supports all of the Edmonton seniors, older adults. So I'll put those both in the chat. If you're outside of those big areas, you can still look at them because they've also captured some of the Alberta and national things that might be relevant. They just might be missing local ones in your area.
Okay,
but
that's
yes, I will
wonderful.
put that in the chat for you. I'll just find them here.
Okay, thank you so much, Stephanie.
Stephanie, I remember we talked about like sharing the resources in one, any chat, group chat that we can create. Maybe like whoever is coming to this group, maybe we can have one group chat to share all the resources as well. Or sometimes there is some resources like it's existing resources, and sometimes there is new programs that will take a place in future. Maybe we can share them in that group chat as well.
Yes. So adding on to that, now that we're beginning up the fall season, I think let's get that going, and then we can have that place, as Azita mentioned, to share. Yeah, we'll get that going. I'd also, we haven't really announced, but we would like to also highlight that we have Tatiana here as one of our new group leads as well, that joined over the summer. So just as a celebration that Tatiana from Jewish Family Services Edmonton has stepped up to join the group leadership team for this group. And welcome to the first, I guess, fall. It's not really fall yet. Our first new season event. But on that note, I guess if we don't have any more questions or comments for Heather, we'd like to thank you very much, Heather, for your presentation. It was very helpful, gave us lots of information. I know folks have asked in the chat if there's some of your resource pages, if we'd be able to get those from you to send out to folks, especially that one with all the links on it.
Yeah, definitely. I'm happy to share the presentation and to connect with folks offline as well. If you have specific questions, the presentation has my contact information at the end. So would love to chat with some people.
Wonderful. Thank you so much. So we'll send that out in the post email with the recording if there's parts you want to watch again, and with any of the other things that are relevant in that email. And otherwise, so thank you again, Heather. Thank you so much for your presentation. And I'll pass it back to Yao, who's going to start us on the like a circle conversation with our updates.
Yeah, thank you so much, ladies. I enjoy the presentation and the discussion afterwards. I think all of us learned something today, and by sharing the information and our resources, that's really wonderful. So as the time, okay, so we still have time. So we would like to, our last activity is actually to go around the room and for everybody to update. So do you have any, like in your agency, do you have any updates that you would like us to know? Or just generally simply introduce your program if you don't have any updates? Like we would like really to hear from everyone. Yeah. And I think this is the time for me to mention that our next meeting, is this the time that I mentioned that will be on October the 30th. Then we have Carol Shing from Government of Alberta.
October 10th.
October 10th. Oh, yeah, we switched.
Yeah, the two dates. You know, the 2 dates.
No, initially it was October 30th.
Sorry.
Yeah,
it will be October the 10th. Before I forget, I just want to remind you that we're gonna have our next meeting will be on October the 10th, and we have Carol Shing from Government of Alberta, and she's gonna
actually
give
we have
us
the whole age-friendly Alberta community of practice is joining together with us. So
wow, it's a big event.
Yes, it's going to be a big one. So the reason answer, I know some folks have reached out of, the 30th had changed. Just give you a bit more background. We had been planning an age-friendly conversation for October 30th, but then the age-friendly community practice was planning an immigrant-heavy conversation for October 10th. So the two core groups have decided to merge our efforts in October and have a really inclusive and fulsome discussion about age-friendly communities for older adults, immigrant older adults in that. So If you've received my email already, I sent out October 10th dates. If you haven't, we'll be sending a post email after this event to give you that information so you have the right link and the right room and the right date and the right time and all the information that needs to happen for that. So we'll definitely send that out in our post email here.
Right. Thank you, Stephanie. I just instantly delete that October the 30th. Okay, thank you so much. Okay, so let's go around the room and to give everybody an update, since we don't have the chance in the first beginning of the session and we didn't have a chance to talk, and now it's the time to talk. How do we do this? Do you want me to call your names, or we just voluntarily can do that?
I would volunteer
Okay.
voluntarily.
Thank you so much,
Sorry,
ma'am.
always, yeah. And here it's a quick broadcast, yeah, to promotion my project. So our pursuit of happiness for immigrant seniors project will start recruitment for new intake starting on October 8th. Until the end of March. So the purpose of this project is to teach seniors the skills and the resources and empower them to practice leadership skills to contribute to their community and to learn to enhance their skills about aging in place to become happier, healthier, and more independent. So we cover physical and mental health and financial, digital, and legal literacy, and a variety of recreational activity to help them to connect with their community and making new friends. It's integrated knowledge and information learning, and also social recreational activities. So yeah, and if you know any seniors who can speak, adequate English, because we need them to be the ambassadors to their community, please refer to us. I can share our project information maybe with Stephanie, because you have the emails of everybody. You can share with everyone. And also, I would love to invite your ladies to be the guest speakers. If you would like to share any information which is beneficial with for the seniors, you are highly welcome to contact me. Yes, that's all. Thank you so much for the opportunity. Thank you.
Yeah, thank you, Min. Probably you should leave your email address in the chat box, right? So everybody can reach you out if they're interested.
It's good idea. Thank you.
Thank you so much, Min.
Okay.
Yeah, anybody else would like to share any updates or anything? Yeah, just general. Jen, please. Sorry.
To introduce myself, I'm Jennifer. My company name is Brain Health Catalyst. I formerly led the community project to make Okotoks the first dementia-friendly community in Alberta. And my interest in this group is from a couple different angles, but mostly Josephine and myself are working with another colleague to put together a letter of intent for, or we have put together a letter of intent for the Public Health Agency grant funding announcement. We'd like to be working with immigrant senior populations on the direction of healthy aging, aging in place, everything that Min was mentioning, but specific to offering educational workshops in the domain of cooking and soup workshops. I've done some soup workshops in a number of different rural communities. And so we've put together this letter of intent. We don't know where that's going to go yet, but just wanting to get more connected with what is happening in the sector. And so feel a lot more knowledgeable about all of your folks sharing. So it's been very helpful in that domain. Taking that hat off and putting another one on, as Stephanie mentioned, the caregiver-centered care program education that is being offered through the University of Alberta. We are starting a community of practice, and we're reaching out to folks who might be interested in joining our community of practice. And we're focusing on how would we create a community of practice specific to caregiver-centered care. So this caregiver-centered care work has been underway for quite a long time, led by Dr. Jasneet Parmar and Dr. Sharon Anderson out of U of A. So that sounds like some of you have met those amazing folks. And so we're just recruiting for this community of practice. There is a small $200 honorarium for participation. We're getting close to capping our numbers at 50 participants. But if that's something that you might be interested in knowing a little bit more about, you can contact me. I've just put my contact information in the chat box there, and love to have a conversation with you about how you might contribute to that community of practice. The time commitment is a series of 3 one-hour meetings, and to have reviewed some of the content on caregivercare.ca. And yeah, look forward to chatting with lots of you in the future as we move forward.
Thank you so much, Jennifer. Is any one of you have any questions for Jennifer? Okay, if not, we can move to the next lady. Thank you. Jordana, were you going to say something? I'm sorry, I just saw your you mute yourself, and I was wondering.
I wanted to give
Okay,
other
thank you.
people a chance. Hello, everybody. It's my first time joining this group, and I'm so happy to be here because I'm hearing so many things that are relevant to the work I'm doing. I'm a registered nurse, and I'm a faculty member in nursing, and all my research is on immigrant and refugee older adults and their health. One of the projects I'm currently working on is to co-design with seniors a health literacy and outdoor walking program. We're in the co-design phase working with the South Asian communities, so seniors that speak Urdu, Punjabi, and Hindi. And the Indo-Canadian Women's Association is a partner. We have nursing students that are designing the health literacy topics, and we are looking for ideas and collaborations in this work. So it's just been amazing hearing about all the different projects everyone is involved in. I can see so many synergies. So thank you.
I can go next. Yeah, I'm with the Caregiver Alberta. My name is Soba Joshi, and I'm really happy to be with this program. And I really wanted to learn. It is really good to learn from different sectors and knowing about caregiving and all, because my role is caregivers, in caregiving, and then personal interest is I'm an immigrant to the country, and I know I have a lot of experience working with the immigrant and school children in the past. So it's a lot of challenges for all the new immigrant to country and health sector and school sector everywhere. So I'm so happy and so grateful to be here. So our upcoming program are kind of just like to update the big conference is coming on November 1st and 2nd. Caregiver conference is coming on that, and also I am located at EDRI, and then I have started some program in person in EDRI library. This is a peer support group program, and anyone who's looking for support, I speak different languages. I mainly focus on South Asian, Hindi, Urdu, that language I speak. I'm a caregiver coach. Nice to meet you, everybody. Thank you.
Can I go next? Hello, everyone. Thank you so much for attending. And so I'm Parminder Gill from Immigrant Services, Calgary. I'm working with seniors program, specifically 55 and older, multicultural seniors. So we have an upcoming project with Mount Royal University, creative writing project. So we will have multicultural seniors, and we will pair up with creative writing students from MRU, and then we will have stories or poems, and then we will publish a book. So this will be our, I think, 6th anthology. So we already have 4 books and 1 video anthology during COVID. So if if you have anyone who is 55 and older, would like to join, have this kind of interest, please let me know. We still have some spots available, they can join. Okay, and I can provide more information. I mean, it will be weekly activity every Wednesday from 1 p.m. to 2:30. Thank you.
Josephine, please.
Hi, everyone. It's lovely to meet everyone. I'm also new to the group. In addition to working on possible projects with Jennifer, I actually have connected with Stephanie and Rebecca a couple of occasions to explore the possible need with immigrant caregivers. So my company in 2021 was able to create some well-being tools called Tools for Caring, specifically for caregivers, that uses evidence-based well-being science and the science of happiness to ensure that their journey doesn't lead to burnout, basically. So yeah, I'm in alignment with what you were saying about just sort of a happiness project, like that's sort of the avenue that we specialize in. So I come to the conversation just with an interesting lens that I find lends itself well to the health equation, which is happiness and well-being and positive psychology. So I'm really happy to be a part of this group and look forward to just learning from all of you and connecting. So thanks.
Thank you, Josephine. Anyone else would like to share any updates? Stephanie?
I can do Healthy Aging Alberta update.
I'm gonna do later.
Yeah. So I'll do the Healthy Aging Alberta updates here. So I don't know if you've seen yet, but Healthy Aging Alberta just launched yesterday. We have 2 positions open right now as far as new jobs with our team. And one of those, Calgary folks, our Calgary Regional Community Developer role is now live. And hopefully we'll have that soon to support all of you working in Calgary. And all those of you working in Central Alberta, we also have the Central Alberta Regional Community Developer role that's posted. So we have those 2 RCD roles that are open for our team right now. If you're interested in applying for them, you can join our team. And then if you want to learn more about regional community developers, then you could we are able to connect you with them once they're in that position, because those folks will work with your organization to track what you have, what's working really well, what goals you have for the future, maybe what issues and trends you're seeing, help you with your strategic directions, and where you're hoping to take your programming and organization in the near future. And they really keep their finger on the pulse of what's going on in Alberta so that we can elevate those to a higher level and see if there's provincial strategies that can happen around those issues. So those are open. In regards to the work that the regional community developers do, many of you have played around with the Healthy Aging Framework card deck before with your organizations. And if you're not sure what that is, you can always reach out to us and we can get somebody to come and work with you with the Healthy Aging Framework card deck. But that being said, we are very shortly launching the digital tool. So we will have the digital card deck here soon. You'll see that coming out in promotions rather shortly here so that you can work with that with your organization internally on, and that can really help you plan, do some of your strategic planning for the upcoming years of what you would like to do for for older adults. We keep talking about it, but the systems map will be launching here soon. There was a few delays over the summer, so we had to push our timelines, but you'll see our systems map coming up soon. You'll also see some of the updates for the Equity, Diversity, and Inclusion Alberta strategy that we've been or sorry, not full strategy, but the work that we've been doing there. And if you came to the regional gatherings, you were introduced to that work. So there'll be some updates coming out soon about that. And if any of you are really working in the social prescribing sphere, or you're really passionate about social prescribing, we had 2 wonderful informational videos that just launched here a few weeks ago that are resources for you to use to talk about social prescribing and what it is and the impact of that work in the community. And those are on the Healthy Aging Alberta YouTube if you need to pull them for your resources and be able to talk about what social prescribing is and what it's benefiting. Yeah.
Thank you so much, Stephanie. Do you have any questions for Stephanie? Okay, if not, we're just gonna move to Dr. Rose.
Thank you. Nothing majorly different from the last time, but I did want to introduce myself to the new members and people who've joined us. So welcome, and I'm sure you'll find a whole bunch of really great insights and inspirational thoughts and ideas from this gathering. So I am still continuing the work around ethnocultural elder abuse, which is the project that I'm running here at CARIA. And the project is nearing an end, which is a good thing, because I'm in rabbit holes sometimes when I dive into a topic. So it's good to have kind of a clear goal and idea and plan. So with this ethnocultural project that we're doing, and one of the outcomes, I guess, or deliverables will be a educational session for service providers, which include all of you, that we will be sharing province-wide around working with potentially clients or older adults who might be vulnerable to experiencing elder abuse, or just being able to address that topic from that culturally from that cultural competence and humility perspective. So hopefully you'll hear more about that training session in the next few months. The project is generally expected to end by December of this year. So hopefully before that, you'll hear from me about coming into your organizations and talking to your staff members about this form of training. In addition to that, from that conversation with ethnocultural communities, I've developed a basic legal literacy program for low literacy and or illiterate ethnocultural communities, which include older adults, but also adults as well, who want to know what their basic legal rights are, including understanding how the Alberta justice system works. And this is also something that we have received a fund to do. And it came out from me discussing financial abuse with ethnocultural older adults and community members, and them not really knowing what their legal rights are, or what personal directives or power of attorney versus enduring power of attorney and wills are. And I am very pleased to be running these sessions throughout until early next year. And I'll be visiting Immigrant Services Calgary with Parminder and her clients to run this program. So this is a basic legal literacy, and I know a lot of organizations provide a more advanced legal clinics, etc. So this is really targeted towards low literacy, illiterate, ethnocultural community members, clients, and it's basically scaffolding their knowledge. So when they do go to your organizations, to the legal clinics, they at least have an understanding of what they're going for and what they need to have prepared. And so I am just informing them of the basics, and then the hope is that your organizations carry on the more advanced knowledge about their legal rights. And this was done with consultation of a lawyer, of course, because I am not a lawyer, but I am the one who's presenting it because I take away all the jargon that lawyers use. Thank you.
Thank you so much, Ms. Rose, Dr. Rose. Do you have any questions, or if you are interested, maybe Dr. Rose can leave your contact information if someone is interested, or they have more questions, maybe they can, after the meeting, they can email you. And that's what we're doing. We're here. We're doing around the table to just update everyone what you're doing right now and what kind of we're kind of sharing resources, right? That's what our main purpose here. Okay, so I do have two ladies put in the chat box. One is from Christine, I think. She said, "Hi folks, I'm new to this group with Alzheimer Society, Alberta, AB and NT. I do have another meeting, so I have to leave here. And the society, we are starting to explore how to better support people living with dementia and their care partners, families, and friends within different cultural groups, exploring more resources in different languages and working with some groups in Edmonton, in the preliminary stages. I am looking forward to continue attending as I have already gained knowledge from our time today. Thank you and see you next time on the October the 10th. Okay, yeah, sure. We all gain knowledge here, right? Thank you, Christy, but probably she's already gone. But Christine from Alzheimer Calgary Society. No, sorry, not Calgary, but AB and NT, right? It's another, because we have two ladies I know in this group, so they are from Alzheimer Society Calgary, but this is probably
Christine's
different.
from Alberta and
Sorry,
Northwest Territories.
sorry for that. That's more provincial wise. Thank you, Chris. Okay, so the next one we have is Caroline. She said, Caroline for Edmonton Southside PCN here. Okay, noisy, so posting here this way. Okay, understandable. Senior center without walls is open to any Albertan 55 or older, free of charge, to address isolation or as a support for people aging in place. You know of anyone who would benefit from our programs, send them our way. We offer audio-only programming to ensure everyone has the ability to participate. Any questions, give us a call at this number. No, you do not have to be connected to a PCN physician in Edmonton or anywhere else in Alberta. People do not have to be referred. Only requirement is having a phone and working knowledge of English. We also have a toolkit for anyone wanting to set up their own language specific program. We have worked with the French community here in Edmonton and the Chinese community in Calgary. Oh, that's wonderful. Thank you so much for sharing. I think this is very useful. I will personally pass this information to my clients. And Stephanie, also for any Calgary and area folks supported by United Way of Calgary and area and Healthy Aging Alberta. We are a sponsor of Calgary Pride Parade. Oh yeah, this coming Sunday. Yes, September the 1st. Yes, yes. I think every agency is working on that, right? So CWA as well. We're working on that parade this coming Sunday. As we would like to invite you to walk in the parade with us. If you don't already have your own section in the parade, you and your staff are welcome to join us. Here's the link to sign up. Thank you so much for sharing that, Stephanie. Need to leave. Okay, so as many of you need to leave, Eugenia. So she's from the Winds. That's women. Sorry, what's the full name of Winds? I can't remember. It's kind of a women something, right? Help women to.
Women in Need Society.
Thank you so much, Brian. Yeah, and Women in Need Society. Please check their website. They do got good stuff there, so we can help the women and who are in need and supports cultural senior groups. They have twice a week. Thank you so much. And yeah, before you leave, please complete our post survey here. That we want you to give us a feedback so we can work better next time. Thank you so much, everyone. And for me, I think I personally have some updates. So as some of you may know or may not know, I'm Yao. I'm a one-on-one counselor here in Siwa. Our program offers like to youth and senior, and I work for the senior part, one-on-one counseling services, and to help them to build up self-esteem and overcome loneliness and any kind of needs that they need, and we can connect them with any services here in Siwa. And for me, one update is that you know that we have a program, kind of our most successful program here. It's called Grandma's Kitchen. So we gather the immigrant seniors. So we encourage them to come out and do cook, make friends, and learning English and get referral, and to provide them tailor-made like services if they in need. We have. Now we have a new location. We have a southwest location that's gonna we are gonna have in September the 24th. It's still we're gonna have an opening kind of ceremony, but it's an opening thing that we invite every immigrant women 50 plus or a PR are welcome. So if you happen to know someone, from any cultural background, if they're interested and they happen to live in the southeast area and everything, they're welcome to join this event. Just email me. I will leave my contact information here. Just email me or say that you're interested, and if we have more detailed information, we'll let you know. And also I have a link to our Grandma's Kitchen, so feel free to explore that part too, because we have other locations as well. I'm noticing that people are leaving, so I don't want to take much of your time. Stephanie, do you have anything else to mention? No? Then if not, please complete the survey. Okay, I will just put this again. Please help us to complete the survey before you leave, and otherwise I think you're good to leave, right? And we'll see you on October the 10th.
Yeah, we'll see you all October 10th. We'll send out a post email with the recording if you want to watch it again, with the resources of Heather's, and with the October 10th date to everybody who's here. And then we'll see you all there for an age-friendly discussion. And then December, we're kind of tossing around the idea of one around housing, but let us know if there's something else more pressing that you wanted to hear about before then. But otherwise, we're thinking December's theme will be housing.
Thanks, everybody. Bye.
Thank you, everyone. Have a nice long weekend. Bye.